Hi, my name is Molly, and I'm an occupational therapist. I understand that you recently fractured your left wrist. I'm going to show you some activities that you can perform at home in your cast today.
Hi, Molly. Nice to meet you. My name's Shannon.
Shannon, are you right or left-handed?
I'm right-handed.
Okay, since you injured your non-dominant left wrist, it's important for you to use it in the activities I'm going to show you. I want you to know that some of these activities may cause discomfort, and that's okay. You can switch to your non-injured side or use your injured side for support. You can also modify the activity, such as changing your grip or taking breaks.
But pain is bad, right?
Well, some discomfort is okay, but if anything is painful, I want you to switch to your non-injured side. You can always try to perform the task another time.
Okay.
First, let's talk about eating with a knife and fork. Here's some scrambled eggs. Why don't you try to use your hands as you normally do to eat the eggs?
Okay, so at home, I usually cut the eggs with my right hand and I eat with my left.
Great.
So it was a little difficult to turn my hand, but with some effort, I could do it.
Great. You can eat and drink at home as well as prepare small meals like making a sandwich.
That's great news. I didn't think I could use this hand for anything.
Next, let's talk about using that hand for dressing. Why don't you try putting on a shirt, buttoning the shirt, and then tying your shoes?
Oh, my husband tied my shoes for me this morning.
Sometimes when people injure their dominant wrist, it's easier for them to use that hand because they're used to it. But since you injured your non-dominant side, it's important that you try to perform activities that require the use of two hands, like buttoning or tying your shoes.
Oh, I understand what you're talking about. I could easily use my right hand for everything.
Exactly. Here, give it a go. Why don't you try to use both hands as you normally do to button? Great.
It's definitely a little difficult with these small buttons.
Yeah. That looks really good. Why don't you try tying your shoes now?
Okay.
Great job. Last, let's talk about brushing your teeth. Since you're right-handed, you probably brush your teeth with that hand, but why don't you practice opening up the toothpaste and putting on the toothbrush with both hands as you normally do?
Okay. What I usually do is hold the toothbrush with my left hand and I put on the toothpaste with my right.
Okay.
Well, that wasn't so hard.
Great. Continue to do this activity at home as you normally do. Shannon, I'm giving you a handout of activities that you can perform at home. Try to do them to the best of your abilities. Think about how you used your hand prior to your injury. Try to use your hand as much as you can. Now, you can adapt or compensate if something's uncomfortable, but try to be as normal as possible. Again, if it's painful, I want you to stop using that hand and use your other side. You can always try it again later.
Okay. Thank you.
It's also very important to take care of your cast. You cannot get your cast wet. You have a few different options here to keep it dry. First, you can use plastic wrap. I would wrap it just like this. Sometimes you need two pieces. You want to make sure that there's no gaps in the plastic wrap, otherwise water can seep through. And you would secure the ends with medical tape. That's the white tape that looks like this. Or you can use masking tape or Scotch tape. Another option, or in addition, is you can put an umbrella bag or a garbage bag over your hand. I would place it on like this and then secure the ends with tape as well. Last is you can use a waterproof cast cover. It looks like this. Also, you can't pull any of the padding out of your cast. The padding is there to make sure that you have a good fit and that it protects your skin.
Oh, so even if it's itchy, I can't pull it out?
Nope, you need to make sure that your cast stays intact. Lastly, you don't want to put any items inside of your cast. I understand that it's itchy, but placing items inside your cast can damage your skin or damage the padding.
Okay.
I want to give you my email address in case you have any questions. Why don't you take my card and place my email into your phone using both hands?
Okay.
Great.
Got it.
This video has demonstrated how to use the hand of your injured wrist if it's your non-dominant side. If you injured your dominant side, you want to use that hand to the best of your ability to perform the activities on the handout, and switch to your non-injured side if you experience inner pain or discomfort. Remember, the goal is to use your hand to your best of your ability.